Chers amis internautes de la GRF Web TV, bienvenue à l'émission de ce matin dont nous vous parlons c'est quoi la physiothérapie. Alors aujourd'hui, maintenant avec moi sur le plateau le docteur Ashwin Venugopal qui est physiothérapeute. C'est quelqu'un d'étranger qui est basé en Inde, mais là actuellement il peut pratiquer à la Global Rainbow Foundation, au centre qu'on appelle le Rehabilitation and Treatment Center. Alors, un petit brief à propos du docteur Ashwin. Il est un physiothérapeute, comme on peut dire. Il fait une étude à Kerala au niveau de son undergraduate. Et au niveau du post-graduation, il étudié à l'université de Rajiv Gandhi à Bangalore. Il travaille à l'hôpital Manipal en Inde. Et comme on peut dire dans l'intro, c'est que lui actuellement peut travailler comme physiothérapeute à la Global Rainbow Foundation dans le département de Rehabilitation and Treatment Center qui appelle le RTC. Alors, étant donné que M. Venugopal il est un ressortissant de l'Inde, alors nous pouvons essayer de faire l'émission en anglais aujourd'hui. Donc, l'émission en entier sera en anglais. Donc, on espère nous pouvons adapter avec toutes les questions qui nous sont là. So, good morning, Dr. Ashwin. Welcome in our studios. We were chatting a bit earlier before the program about where you're from and what about your studies you've done. So the theme for today is what is physiotherapy. So we will try to learn a little bit more about what is the physiotherapy, why do we need physiotherapy, who needs physiotherapy, and are there any different kinds of physiotherapy that exist potentially. So we will look at all of these during the whole of the program.
Sure.
Just to inform our viewers, would it be possible if you just could give a brief intro about yourself? I did give a brief intro in Creole about what you do, who you are, etc., etc. But it would be much appreciated if you could give a brief intro about yourself, what you've been doing, for how long you've been in this field, etc., etc. So, Dr. Ashwin.
Yeah, sure. Good morning, everyone. So, myself, Ashwin Venugopal. So, basically, I'm from India. I have studied my undergraduation from Kerala.
Mm-hmm.
Then, after, it's a 4.5 years of course, physiotherapy everywhere. So 4 years of studies, and after that 6 months there is an internship.
Yeah.
So for the internship purpose I have gone to Bangalore. So after that I worked for 1 year. Then again I went for my post-graduation again to Bangalore. It was under Rajiv Gandhi University. Immediately after that I joined in Manipal. It's one of the famous hospital in India. So I worked there for some 2.5 years. Then I got an opportunity here. Then I resigned and came back here. Now I'm working in Global Rainbow Foundation, which is in Pichirafre.
Yeah.
Working as a physiotherapist. Yeah.
Okay.
That's the journey.
Dr. Ashwin, is this your first visit to Mauritius and Global Rainbow Foundation?
Yes.
It's
so
how do you feel? How do you like the environment and the country and the people that you've been seeing?
Definitely everything is good. Good in the sense everything is good. In fact, like the people are good, the country is good, less population, less pollution. So in fact, good in the sense everything is good. Some things I miss a little bit. I mean,
maybe the food.
Yeah. Food also, street food. Street food I miss. Otherwise everything is perfect here. It's so clean. People are so friendly and so jolly minded, happy all the time.
Excellent.
So it's good. Yeah.
Thank you. Yeah. The very first, I would say, technical thing that maybe we'll have to demystify is what is physiotherapy? People need to understand in maybe the plain language for the layman, what is physiotherapy?
Yeah, definitely. It's especially in Mauritius, I think it's not quite established. That's what I believe. It's been 5 months I'm working here. So in simple words, I can tell you physiotherapy is an approach in which you can treat the patient through the physical methods. It's only physical methods. There is no surgery, there is no medicine. Some patients come and ask, like, can I get some medicine for this pain? So we don't give any medicine. It's only through the physical methods. And there are lots of methods, like even physical agents also, which includes some machines called electrotherapy equipments. So there are lots of things called TENS, IFT, ultrasound, various things are there. Other than that, basically exercise. I would say the integral part is exercise. Then other than that, many other things are there called cupping therapy. Maybe you must have seen last time Olympics, I forgot his name.
Michael Phelps.
One swimmer. Yes.
Phelps.
Everyone was noticing what is on his back. So that was cupping therapy. We have it here. So that is one of the things. Then taping, dry needling, various things are there. So in simple, it's only the physical methods to correct the pain and the cause of the pain, and there is no surgery or medicine, and you can. There is no side effects.
So there is no invasive procedures that happens.
Yeah. Okay. There is no side effect. That's one of the main point I would say. Yeah.
Okay. I'm just referring to the NHS in UK, where they define physiotherapy as something that helps to restore movement and function when someone is affected by injury, illness, or disability. Now, as you know, Global Rainbow Foundation is very much advocating in terms of disability rights, etc., in the country. How is physiotherapy and disability related?
Definitely.
How does it help if you have someone who finds themselves in a situation where they are in a disability situation, or their family is in a disability situation? So how does physiotherapy help or can help?
Definitely it will help. So if you take few examples, like any disabled people or differently abled people, I would like to call them as differently abled people.
Absolutely.
So you take it as cerebral palsy, autism, or different condition. Most of them are non-progressive conditions. So the problem or the cause of the condition will be there. Suppose in cerebral palsy, the problem is in the brain, which could have happened during the birth or immediately after the birth. So the problem won't deteriorate, or the main problem won't, it won't become worsen, but only the symptoms. Symptoms can be muscle weakness, or it can be a muscle tightness, or their normal living of activities. So we can improve all these things. That is an integral part of the treatment. So in those conditions, in the disabled or differently abled peoples, we can't completely cure them, but we can make their life much more easier. We can make them do whatever they want to do, or the normal, at least activities of daily living. I would say the bathing or eating or all those stuffs. So they'll be able to do in their own way. So to maintain, again, one more thing is to maintain whatever function they have, whatever fitness they have. They have to go for the physiotherapy at least once in a week or twice in a week, so that they can maintain the muscle strength and the range of motion. Otherwise it will become more stiff, and there is something called contracture. The muscles and things, everything will become completely permanently stiff, and you must have seen they will surgically cut it. So to prevent the contracture also, they have to go for exercise or physiotherapy at least once in a while.
So there is no prescribed number of sessions. There is no prescribed number of or defined number of sessions that differently abled people, whatever situation they find themselves in. So you saying that there is no specific definition in terms of number of sessions. So what I can understand also is the more the better. This is what you're trying to say.
So we always, in medical profession, I always try to follow evidence-based practice.
Okay.
So we have evidence behind everything. Even if you take a neck pain, so I can tell you, okay, how many days it can take to cure. Still, there will be speculations, but you can't just you can give a rough idea. But in the case of disabled people, so it's all about, it's long-term therapy. So you can't tell like within one month or 30 sessions are enough to cure this. It's not like that. So even after, once they are fine, once they reach in a particular state or position, to maintain that whatever they have achieved, to maintain whatever they have been doing it, they have to go for physiotherapy. That is as simple as that. So it's not just to improve, also to maintain whatever they have to go for it. Otherwise slowly that also will come down. Not in all the cases I'm saying. There are multiple cases, but if I tell you about cerebral palsy, one of the condition, so if you don't do daily stretching and all, it will completely become stiff. Then finally it will end up in surgery. So you can even prevent
surgery.
So
you want to prevent. So it's more of on the prevention side of the things that you move towards.
Exactly.
Okay. Physiotherapy. The word physio definitely means all the physical stuffs that is associated to that. But are there any different types of physiotherapy?
Definitely, yes. So there are multiple branches of physiotherapy. Actually, I have specialized in musculoskeletal and sports. Ortho and sports, which is related to mainly the bone and sports related. We study everything. In UG, we study ortho, neuro, everything. There are multiple branches. I would say neuro, which is related to nerve injuries. Like, you must have seen the stroke, one-side paralysis, or spinal cord injury, or various multiple sclerosis, Alzheimer's disease. There are various conditions. So that is another branch, neuro physiotherapy. Then cardiophysiotherapy is there, which is related to cardiac issues. So there are some surgeries you must have heard about, open heart surgery, CABG, coronary artery bypass grafting. They say bypass surgery commonly. So after all this surgery, also to maintain, to get back to their normal life, there is physiotherapy. That they are mainly dealing with those patients. That is cardio department. Then if I say geriatric department is there mainly to take care of the elderly people. Then even community-based rehabilitation is there to maintain the community things, and even gynecology. So even immediately after the delivery also, many women, they get many problems like incontinence, when they sneeze, when they cough, they can't control the urine. So such multiple problems are there. So that will be taken care by gynecology physiotherapy. So it's like that. It has different branches. Yes.
Would I be right to say that all of those different types of physiotherapy that you mentioned, they would all still be categorized as being non-invasive?
Yes.
That is, there's no physical sorry. So there's no physical intervention in terms of surgery or whatever it is, or you keep it to the minimum, if I would say.
Exactly.
Okay. There is a question that has been in my head for quite some time. Is there a difference between a physiotherapist and a doctor or a GP? Is it the different stages of studies that they have gone through? What are the similarities? I would say, or what are the differences? If I can say.
Definitely there are some similarities, but in the case of practice, I don't think there are much of similarities. So while studying, all the medical professionals, we start with anatomy and physiology. That is the base of any medical field. So we also started with the dissection in a cadaver, human cadaver. So that's the same. An MBBS student also will start with. But in the case of studies, after first year, that's a base for medical professional. After that, we have our own subjects like electrotherapy, exercise, biomechanics, various subjects. So that we are only studying. But we are, along with that, we are studying general surgery. We are studying about the pharmacology, all the medicines, everything we are studying, even neuro, ortho, everything, as I mentioned before. But in the case of practice, I would say, we don't use medicine. That is ultimate
I've read that between the lines.
A general practitioner or a doctor, they can prescribe the medicine. So the point of view, suppose if you see a knee pain, if you ask me how I see a knee pain, how a doctor or general practitioner will see a knee pain, that has similarities. So if I tell you about knee pain, usually that knee pain is because of the osteoarthritis. Usually there are hundreds of reasons, but one of the main reason is osteoarthritis, I would say. So most commonly in elderly people. So if you ask me, how will I see that? How will I treat them? Basically, we have some modalities. So inside the knee joint, there is something called cartilage, which covers the joint surface. So because of the various reasons, because of the overweight or because of the muscle weakness, this will get stressed all the time, and that degeneration happen inside the knee joint. So because of that, pain, inflammation in the sense swelling and things like that, and pain also will be there for the patient. So that's a simple thing. So if they come to me, I have some modalities to reduce inflammation, to reduce the pain. I'll be more focusing on the muscles to strengthen the to strengthen the muscles, so that whenever they walk, whenever they climb stairs, the joint load will be lesser and the problem will be solved. But the same patient, if they go to a doctor or a general practitioner, they will be focusing on the pain, inflammation and things like that. But for the pain, they will prescribe an analgesic. For inflammatory, they will prescribe an anti-inflammatory, NSAID or whatever. So treatment approaches are different, but the concept is the same.
The concept is the same.
Yeah.
Okay. Another, I would say, practice probably, which is sometimes people look at it, maybe it is the same thing, or it is similar to what a physiotherapist is doing. What would be the difference between a physiotherapist and a chiropractor? This is probably the most similar in terms of
even
what
I've got these questions multiple times. So a chiropractor mainly they'll be managing the positional fault in simple words, I would say. So if there is any, they will be looking at the joint malalignments. So suppose if the joint is like this, mainly at the spine level, they can see they have the assessment table and things like that to understand if there any problem with the joint alignment. They will just immediately correct it with the thrust. You must have seen that crack things like that. So that is called thrust or manipulation. So they'll be correcting through that. Even I do that, but there are various things also I'll be focusing on.
Okay. If tomorrow I do have a pain in my knee or at my back, would I be right to go see a doctor first and then come see a physiotherapist, or should I go to a chiropractor? What would be the analysis for me to visit one of these specialists?
As you have multiple options, yes.
So what would be?
See, wherever you go, it's main thing is understanding the cause of the pain or cause of the problem. So wherever you go to a doctor, you go to a physiotherapist, you go to a chiropractor or whoever. Ultimately, you should find the reason behind it. That's what I always tell to the patients. You should know what is the reason behind it. What is the cause of the pain? What is the cause of your symptoms or whatever, pain or paresthesia or whatever. Then if you're taking the treatment, just think whether that treatment is correcting your cause of the pain or not. It's as simple as that.
So if you go to cause and effect, and then you see
exactly. So if you go to anyone, it can be due to various reasons. Your knee pain can be due to various reasons. It can be a bursitis, it can be an osteoarthritis, it can be a patellofemoral pain syndrome, it can be anything. So ultimate thing is understanding that. Once you understand what is the reason behind it, then you can just check which profession is suitable to correct that cause of the problem. Then you will get an idea. Once you understand what is the cause behind that, you will get an idea and you can choose appropriately.
Okay, so that was a little brief of the various similarities maybe we have in the various services, chiropractors, doctors, GPs, and physiotherapy. Now, coming back to Global Rainbow Foundation and the RTC, which is the Rehabilitation and Treatment Center, what do they do at RTC? What are the services that they provide at RTC? You just briefly describe to us.
Yes. So here
mainly within the physiotherapy, of course. What
definitely physiotherapy is one of the service that RTC is providing here in GRF. Other than that, even occupational therapy. You must have heard about occupational therapy.
What is the difference, occupational therapy and physiotherapy?
It is mainly occupation related. That's the name itself says it's occupational therapy. So it's more or less similar, but they will mainly focus on the occupation or activity based treatment. So if you want to achieve some particular goal, it's better to go to occupational therapist. They will have a better idea about that. Then we have psychologists for different mental issues. See, mental issues in the sense it's not everywhere, wherever I have seen, even in India also, it's a bad word to say, mental problem.
Mental.
Everyone can say, okay, I have a stomach problem, I have a health issue, I have a knee pain, things like that. But when you have a depression, when you have any kind of mental issues, people hesitate to say that. So you shouldn't. I strongly believe that you have to openly say that, because it is 50-50. 50% health and 50% mentally also you should be completely fine. So we have a psychologist also for counseling and things like that. Then we make processes here, processes in the sense artificial limb for amputees mainly. So
is there any relation between what you practice in terms of physiotherapy and maybe for example any person who has been amputated, and do they need physiotherapy, and ultimately they would use the prosthesis? So what is the process there?
Definitely. So due to various reasons, if somebody gets amputated at any level, first thing is stump management. So the whatever remaining portion of the limb is called stump. So the management is very, very necessary. There shouldn't be any swelling. It should heal properly. It should have ultimate or perfect strength and shape to fit a proper processes. Otherwise, if it is in an awkward shape, or if it has multiple sores, or if it is not healed properly, if there is lots of swelling, then ultimately the person won't be able to wear a prosthesis. So initially the stump management, that is ultimate thing, I would say. So in that, definitely physiotherapist has a huge role in strengthening case, in various things. So
is it before the usage of the prosthesis?
Definitely.
During and after as well?
Definitely.
So it is a full process of the physiotherapist.
If you ask me a proper protocol, it has even before also, because see, immediately after amputation, there is a way of putting the bandage. It's called rub bandage to prevent the swelling. There are positions you have to keep to prevent contracture. Otherwise, the stump, the remaining portion, will be stuck in some particular position. Then to maintain the muscle strength, whatever they have, so the physiotherapist can assess, reassess, and plan a treatment to have a proper muscle strength, so that later on the person will be able to use the processes. So that is before. So immediately after that, so once a person wear a processes, how to walk with that, how to rehabilitate with that, how that person can achieve the things with that. So again, that training will be given after the installation of the processes.
Okay. And all of this is done by RTC, where you currently working.
Exactly.
So it's the full process of the initial steps to the in between, and then at the end as well, and even after that.
Exactly. So we'll be taking the opinions from everyone, not only the physiotherapist. We'll be taking the opinion from the occupational therapist. We have the prosthetist, so we'll be taking the opinion from them as well. Even
the psychologist, I believe.
Yeah, psychologist also. Definitely.
To work on,
it has a huge thing on psychologists also. So everywhere.
So all of these are already available.
It's a combined
it's a one-stop shop decision in terms of services that is being provided. Excellent. Coming back to the physiotherapy that RTC provides, you mentioned earlier that it's basically a non-invasive process. It's more on the physical side of things that you work. But do you use any kind of equipments or technological equipments to help you achieve certain results?
Definitely. We have various number of equipments. So I would start with there are so many things. So see, if you take medicines,
maybe the essential ones.
So suppose if you have a knee pain, we'll talk about the knee pain itself. So as I mentioned, there will be pain. So to reduce pain, we have lots of equipments like TENS. One of the machines is TENS, transcutaneous electrical nerve stimulation. Then IFT, interference therapy. So various things are there. SWD, MWD, laser. So many machines are there. Second one, if there is any weakness in the case of stroke, or if you take any case, we have machines to strengthen them called neuromuscular electrical stimulator. So various machines we have. And as I mentioned, non-invasive. Definitely, it's all non-invasive. But everyone must be knowing about acupuncture. So we have. It's not acupuncture actually. We do with the same needle. It's called dry needling, but the principles are little different. So in acupuncture, I believe that it's a Chinese medicine, and I believe that there is an energy inside the body, and if there is any obstruction in the energy flow, you'll get the pain. That's a concept of acupuncture. So they'll put the needle over there, and the energy flow will be normalized, and you'll be pain free. That's a logic. But in dry needling, due to various reasons, if you overuse your muscles, if due to various so and so reason, you can get the trigger points. Something called maybe you will, when you palpate your muscles, you will get a tight nodule, which will be very painful, or other tight structures. So to release that, it is due to various reasons. Various metabolic changes are happening inside. So that's how it is creating. So once you put a needle, automatically it will get released, and the muscle relaxation also will happen. So it's effects are the same. Like if you take a medicine, what all the effects you are getting, the same you'll get it. But maybe in case of acute things, suppose if the patient is suffering with very very severe pain, I don't suggest to go for a physiotherapy immediately, because if they are in so much of pain,
the subsiding of pain,
yeah, exactly, it will take a little bit of time. Not in all the cases, I'm saying, but usually. So initially maybe they will go for a medicine, then they can come back. And invasive, definitely needling is an invasive thing. That is only invasive thing in physiotherapy. So that is also not you won't even get a drop of blood also. So another thing about medicine also I have mentioned, we don't use any medicines. There is another thing called ultrasound. It's again we use actually a medicine called anti-inflammatory or painkiller, just to apply on the skin along with that machine, so you will get a better benefit. So that is called phonophoresis. So that is also there. So but other than that, nothing. We don't use any medicines, or there is no other invasive.
You stay very far from the medication, I believe. And all these equipments and tools that you mentioned are available at RTC, and you regularly use those equipments with your patients. Excellent.
I would like to add a few more points.
Yes, please do.
So when you asked about equipments, we have electrotherapy equipments. We have it here in RTC. Ultrasound we have, TENS we have, IFT we have. Recently also we bought some new machines from India. Then we have cupping. As I mentioned before, we have cupping therapy. We have taping. There is something called taping. Maybe you must have seen in athletes. Some different color, red, blue colors of tape. We have
professional
that as
athletes
well.
mainly.
Yes. Then we have needling. We have different.
Okay. So RTC is fully fledged in terms of the various equipments that they use. That's excellent.
Though it doesn't look, but it has.
From outside, people would say probably they do not have. But it's good that you mention it, and I think it's a very good thing that we have such things already available at Global Rainbow Foundation within the Rehabilitation and Treatment Center. So I think this is very good for the people already coming to RTC and making use of those equipments through you specialists. So I think it's a good idea. It's a good thing that people know that these equipments are already available here as well. We touched on the aspect of differently abled person a bit earlier. I would like to go a little bit further into that. In terms of the intervention, or in terms of working with differently abled people, from a physiotherapist point of view, how different it is, or is it any more complicated to work with differently abled people for physiotherapy session compared to, I would say, other people who are in their normal life? They've gone through, they've injured themselves, etc., compared to someone who's differently able and is living with that disability for quite some time. So how different it is, and how complicated it is, if it is complicated at the end of the day. So how do you manage that? How do you work towards that?
Definitely there is difference, but I don't think it's a complicated thing, or it's not a burden until if you like to do that. Definitely it is like you will enjoy the process. So for a normal person, if you ask them to do anything, they will just do it immediately. You tell them do this exercise, they will do it immediately. But to a differently able person, you will have to make them do the exercise or whatever you want them to do in a tricky way, in a different way. So for that you should have patience to do, and you should have time. So in a different way, everything is in a different way you have to do it. You can't expect the same, like how you are dealing with a common person, and you can't deal the same way, in the same way to the differently able person. But it is a different process, but it's a good process. I didn't feel it's complicated.
Okay. As mentioned earlier, again, Global Rainbow Foundation has a very good reputation in terms of looking at the differently able people taking care of them and having this center available to all of the people, of course, but with a special mention to the differently able people. But the question is, do you or does RTC give special treatment to differently able people, or they considered the same?
Definitely they give.
Okay.
They give. Those who are able to come here, they come here in RTC and they take the treatment on regular basis or however possible. If somebody is not able to come here, we even provide home visit also. We visit multiple places. Even we have visited.
So you have home visits as well?
Yes.
Okay.
I have visited in South also with
already
many kids. Yeah, many kids. Because they are not able to come here, they can't reach out here. So we go there, whatever they need, like if they need a wheelchair or whatever, we can do it. I strongly believe that I have seen it with my eyes that they are doing it, they're doing a brilliant job with that. So it's not the same, how they are dealing with the differently able people.
So there is also that outreach part of the RTC that you're doing, that is the home visits and everything that you do. How does that work? Do you approach the people who are in need, or they do contact the RTC?
Definitely.
Or it's a mixture of both, potentially?
See, I'm working here since 5 months, so I don't have much of contacts.
Yeah.
So normally, people, my patients, they recommend to other people, their relatives or friends, they come. But mainly, Dr. Armugam sir.
Yes.
So he has lots of
the founder,
contacts.
Yes,
so he find people. I don't know how he find.
No, I think there is. Sorry to cut you off there. There is the outreach and events department. I think this is where these leads gets in. And of course, yes, our founder president of Global Rainbow Foundation has huge contact as well in terms of the network. So I think that does help as well. So I think to answer maybe part of the question is, I think the outreach and events department also gets a lot of requests, and through the medical camps and things that they do. So it's more of going out and reaching out to those people who are, as you said, maybe far from the location.
Yeah.
Okay. I would ask the control room if they could play a short video. We have a short interview video of one of the patients who was at RTC very recently. So they will share their experiences. So we'll watch that.
Sure.
Bonjour, et je m'appelle Ratiben. J'ai un problème douleur dans les bras, et puis j'ai un problème douleur dans la colonne vertébrale. J'ai un indice glissé, des nerfs coincés. Et on peut faire mon traitement avec le docteur Ashwin depuis au moins une 10 sessions. Je suis bien soulagé. Et sur technique, sur thérapie bien bon. Et moi, je suis très soulagé. Et quand je me faire une opération, mais là, avec ce banc de thérapie, je suis bien correct, je fais 10 sessions, je l'amène bien largué, parce que je l'amène tout, et je peux marcher, boiter, douleur, je peux descendre dans les reins, les pieds droits, qui peut affecter. Maintenant, pour moi, 95% bien soulagé. Je remercie le docteur Ashwin et j'espère mon correct. Et je de l'adresse, nous prenons un traitement là à Rainbow Foundation qui trouve à Pétirafré, Royal Road Pétirafré, juste à côté de Chihuahua.
Ça fait 1 an que nous avons un problème de back pain, c'est-à-dire douleur dans les dos. Suite qui me tient le laser, je l'ai pour aller d'un seul côté des bras. La main droite, je l'ai ça là, l'eau, je me rappelle, je l'ai 5 côtés. Et puis ça, ce lendemain, je commence à avoir un problème de douleur sciatique, douleur de dos, qui va avec atroce, c'est bien atroce, et que parce que commencer les briller, mon pied briller, mon bac, mon dos briller, mon pied descendre dans mon pied, et que c'est insupportable. Mais moi, j'ai plusieurs docteurs, maintenant j'ai un docteur qui m'a fait une surgery. Mais je n'ai pas une belle patience, mais tout le monde avait un camarade qui n'a pas trouvé une Global Rainbow Foundation. Une Global Rainbow Foundation. Une de physiothérapeute, M. Ashwin Gopal. et que un advisement qui inexpliquement mancal, inexpliquement comment nous gagnons ma douleur là, comment nous 10 capable de déplacer quand nous faisons un faux mouvement, et inexpliquement les sauts qui là, inexpliquement sur un exercice qui les a fait, et suite sur un exercice qui nous fait faire là, et un physio qui nous fait faire, mon sentiment bien soulagé. La faire 6e session qui nous ici là, mon sentiment soulagé, ma douleur bien diminuer comparé avec un côté de sacrose que nous sommes capables d'assiser, comment je peux commencer, je peux gagner douleur, mais là mon douleur est diminuée et que nous pouvons suivre mon traitement avec, comment on dit, au Global Rainbow Foundation qui se trouve à Royal Road de Tirafré. Le cas prend contact avec lui, de téléphone ici, je demande M. Ashwin Venugopal. Ok? Et qu'il vous donne un traitement qui disait, il vous donne un advice qui disait, et qu'il vous donne une session de l'exercice que je vais suivre à la lettre. Et si je peux suivre ça, je peux faire une session d'exercice là, je peux faire un exercice là, un mouvement qui est déjà tout à l'heure. Je peux tout soulagement et je peux tout gagner ce traitement qui disait. Merci.
Okay, so we are back after the short video of the various patients. They do like you. I can say that. They've been very happy with the services provided, especially by yourself. Are you alone within the department? Because I believe you have another colleague who's within you with you in the department. How is it working, and the number of patients that you're able to cater for on a daily basis? Is it okay or?
Yeah. So as I mentioned, it's a teamwork. Mm-hmm. So we have 4 physios,
yes.
4 physiotherapists we have, and we had two occupational therapists, 1 psychologist, and even 1 speech therapist also used to come on Saturdays. And we have prosthetist, everyone. So it's a teamwork, and patients are there. It's like, as I mentioned, initially when I came here, few days, it was quite less. But now it's okay. It's okay, daily basis it's okay. And we are seeing pre-appointment patients actually. So it's actually duty is 9 to 4. So they have to call and they have to pre-book it for the session. Then for approximately 1 hour. The treatment will take approximately 1 hour. So hardly, but still, because of the more number of patients, sometimes I stretch my duty also, like 8 to 5, 8 to 6. Sometimes I work. So it's good.
You go late. Yeah. You late.
Some days, because many people. Not every day. Definitely not every day. Because sometimes even they are working. Many people are working. They are coming from Port Louis after the office. They take permission 1 hour. So I also have to sacrifice sometimes. So some days it happens. So otherwise it's going well. Yeah.
Okay. There is one factor I wanted for us to discuss is age a factor of consideration when doing physiotherapy? Because I believe someone who's in their mid-30s, 40s, and someone who's in their mid-70s and 80s, would there be any difference in the approach that you would take, for example?
Definitely, yes. So as I mentioned, it has lots of exercise, not the exercise what you see in the gym, like weightlifting and things like that. So our body is like you consider it's like a car. So it has different things. So each muscle has different function. If you want to rotate, if you want to move your eyeball towards the right side, there is a muscle, particular single muscle is working. If you want to rotate your shoulder, there is a particular single muscle is working. I mean, which is moving the shoulder. At the same time, there are some muscles which is stabilizing your shoulder in particular position. So many people get this sudden catch of back or neck, things, pains like that. So usually main reason is the muscular imbalances. So in the case of muscle strength as well as the symmetry, I mean the flexibility, it should be symmetrical on the left side as well as the right side. Many people, if I have seen on the right side the muscles will be strong, on the left side it will be either not that strong or it might be more tight. So when you lift something you will get the pain. So things like that. I diverted, I think, from your question.
No, I think you got it right there. In terms of
age.
Yes.
So definitely. So it is different from individual to individual. That is one thing. Age is definitely, we have to consider to a aged, per individual, because there will be lots of complications. So after 60s mainly, there'll be common things are there called osteoporosis. Their bone will be frail or fragile. So even the other structures, muscles, everything will be little soft or delicate. So while dealing with them, you have to be little delicate, and you have to take care of them in a better way. And there is something called cardiovascular fitness also. So even by myself, if I am going to a gym, if I do workout, I should check my current fitness level. Just I can't consider just my age is okay this much and I can work out this much. It's not like that. So there is something called target heart rate. So there is a proper assessment before any treatment. If you go to gym, if you go to any exercise, or if you do anything, we will assess how much that person is capable to do that particular thing. So definitely in aged people it will be deteriorated, so we'll consider more.
Okay.
So that we can prevent the complication, because if a person come with a small pain, I don't want to, if I can't give a improvement, I don't want to trouble that person. So assessment has a huge part in that. So always we assess for the complications, and then we prescribe the exercises or treatment. Okay.
So that would also mean that the number of sessions or the session types that you would have probably worked or prepared for a younger person compared to an older person would be different.
Yes, it's not just because of the age. Sometimes, age is a factor.
Depending on the capability as well. In terms
capability
of what
as well. Even, everyone's body reacts in a different way.
Yes,
my
absolutely.
body reacts to some medicine or treatment in a different way. Your body will be reacting in a different way. Healing has different pace in different bodies, different individual. So definitely age is a factor. In aged people, it will take maybe a little more time because of the healing. Everything will be a little delayed. And degeneration or the deterioration will be little more. So definitely yes.
But to the extreme, physiotherapy is not excluded for old age people.
Definitely not. See, the main thing I would say is the main important problem. Definitely pain is one of the main things that all the elderly people are suffering with. But the main thing is fall prevention. That's what I strongly believe. So the person, even 70-year-old person also will be walking around, they'll be very active, but once they fall down, as I mentioned, it will be osteoporotic, most of the people above 60. So the bone will be very soft, the decalcification happen, the calcium level will be less on the bone. So even if they fall, gently also they can get fracture. Once they get fracture, maybe they will have to go for surgery, or else 4 weeks or 6 weeks of immobilization. So in that period of time, they'll become bedridden. So fall prevention has a very, very, very huge role in physiotherapy or elderly rehabilitation. Because if they fall, as I have seen, they'll become bedridden slowly. So that shouldn't happen. So fall, it has I'm not talking about the slipping or things like that. There are various other reasons. Because of their posture, you must have seen their posture will be stooping like this, forward, and because of the muscle weakness at the back. So they won't be able to balance their body even with a normal walk, and with slight deviation they can fall down. So fall prevention has a huge thing. You have to consider various things about fall, because even vision has an impact. Even muscle strength has an impact, balance has an impact, proprioception. There is something called proprioception, kind of a sensor inside the joints. Even if you're standing, even whatever you do, in what position you are. That is because of the proprioception. So everything will be affected. So there are exercise and treatment for each and everything to correct, so that finally you can, have a good stability, and you can prevent the fall in elderly people.
Okay. Maybe one of the last questions, before we end the session is, would you also, maybe not your role, is advise on the nutritional aspects of therapy as well? Because fluid intake is also important to that side of I would say healing, because what you eat, what you drink does have an impact on your physical movements, etc., etc. So would that also be something that you would advise to the patients, or you do already? I know you're not a nutritionist, but I believe these are things that you also look into. Am I right?
Definitely, it's not my scope of profession, but some things, general things we can say. Suppose immediately after the surgery, like if because I was working in a hospital before, so there also immediately after huge surgeries like back surgery or knee surgery, knee replacement or hip replacement or various surgeries. To accelerate the healing process, if you take protein and all, it will be good. So in that case, we say generally you take little more protein, and or in the case of osteoporotic people or bone healing, you take a little bit of calcium, or maybe milk you take, maybe egg you take. That's a general thing, but the proper advice you can get it from the nutritionist, because they will assess all the things and they will give you the proper idea about what to take, what not to take, and definitely it has an impact on healing as well as your health. As I have noticed here in Mauritius, bread is a staple food here, especially the white bread. So everyone eats white bread in multiple times a day. So the main problem with that is you'll become diabetic very soon, because there is nothing in maida to take, and it is harmful for the pancreas as well. So you'll slowly become diabetic. That is what I have seen here, and finally they'll end up in amputation and things like that.
We have a record which is not too good for us.
Yes. So at least wheat bread, I would suggest. So definitely, food has an impact.
Excellent. Okay, a tricky question probably. Can anyone not do physiotherapy?
Maybe at particular time you shouldn't do it. Otherwise, no. Everyone. It's not. It's just exercise. See, physiotherapy means I can just concise into exercise. There are various things, various branches, various treatment methods, but you take exercise. Our body needs exercise, but in a moderate level. So our body is like any other machine. If you don't use any machine, it will get aroused.
Rust.
Rusted.
It will not work.
So then it will start making sound, and you will have to put oil. So it's literally the same function in our body. If you take knee joint again, if you don't move your knee joint, maybe you must have seen after the fracture and all, they will be mobilized for 4 to 6 weeks. The joint will become completely stiff. The muscles around that will become completely stiff. Then when you try to move, you'll get lots of pain. And there is some fluid also inside the joint called synovial fluid. To produce that, at least you have to move it. Otherwise, it won't get produced also. So that fluid will lubricate the joint, and it makes the movement also free. So
more the movement, more the fluid, the better it is.
Exactly. So exercise is an integral part of our human, life. That should be a routine for anyone.
I think you're motivating me again.
Regardless of pain or problem. No. If you become sedentary, maybe if you don't have pain, you may become more, you will be having cholesterol or sugar or hypertension. You can reduce all these things through the exercise. Just general exercise I'm talking about. I would say swimming is one of the best exercise. We have a good beaches, the world's best beaches here in Mauritius. I was wondering, when I saw the beaches here, I can't compare with Indian beaches. So then cycling is one of the another. But see, after some point, you will have to check with your current health status, and you will have to go for the exercise. Otherwise, again, it will end up in problem. You must have seen many people, I don't know in Mauritius, but in India, many even the film star also, they recently multiple incidents were there that dying in gym. Many sudden death in gym during the exercises and during the workout. So they have to check properly what is their current health status, and they'll have to keep monitoring till what extent the heart rate is going and BP is going. Otherwise, it will be a problem.
Excellent. Thank you very much, Dr. Ashwin Venugopal. If tomorrow someone needs to contact or to come to RTC and they are interested in the services of physiotherapy or any other services that is provided by RTC, I believe you are open full week, Monday to Saturday.
Exactly.
And I think Monday to Friday it's 9 to 4. And Saturday is 9 to 12. And there is a pre-booking system that is in place. So the phone number would be 264-3103, 264-3104. So 264-3104, 264-3103. Donc si vous voulez prendre un rendez-vous pour des sessions de physiothérapie, donc n'hésitez pas à nous rappeler pour prendre des rendez-vous. Alors, so thank you very much, Dr. Venugopal. Sure. It has been a pleasure having you. I think we've been trying to have this session for quite some time, but it's been a pleasure having you today in the studio. So thank you very much, everyone. Merci à tout le monde. monde. Merci à tous les amis de la GRF Web TV. On se verra la semaine prochaine et à très bientôt. Merci. Au revoir.
Thank you.